Hi guys, good evening and happy Dasara. So today's video we are going to discuss about what to do after MD pathology. So what are the career options we have if you want to do a further studies. So I believe we have two options. One is a fellowship which will be ranging from 1 year to 2 years of duration, and next will be your DM. So what all DMs we can do after MD pathology? So to clear a DM, we have two exams. One is NEET SS, which will be conducted by the NBE, which is once in a year exam. So every year it happens once at a time. Usually the exam will be from June to September. Okay. Then next is a INISS. INISS means Institutes of National Importance, where we'll have AIMS, PGI Chandigarh, JIPMER, NIMHANS. All these four institutes comes under INISS. So now let's discuss what all the different specialities we are eligible after MD pathology. So now coming to NEET SS. So NEET SS is conducted by the NBE board, which is once a year exam. It's a here MD pathology is eligible for two courses. One is DM clinical hematology, next is DM oncopathology. Okay, so DM is a 3 years course. So here in a DM clinical hematology, along with MD pathology group, the MD medicine and MD pediatric people are also eligible. So when you are preparing for your DM clinical hematology, you have to read a medicine pediatrics also apart from your pathology. Whereas DM oncopath, only MD pathology are eligible. So what will be the syllabus? It's your MD pathology syllabus, which includes general path, hematology, your histology, cytology, histotechnics and all the recent updates. Okay. So now what is the pattern of this NEET SS? From this year onwards, that is 2022, the pattern is 150 questions. So you will be given a 150 questions. If you mark one as a correct, you will be given a 4 marks. If negative, if you have answered wrongly, then there will be a -1. Okay. So how many are the total number of seats for DM oncopath? I am talking last year's, because this year's seat matrix is not yet released. So last year in Tata Memorial Mumbai, we have a 3 DM oncopath seats and 8 seats in BJMC Ahmedabad, Gujarat, and 2 seats in the Kidwai, which is Bangalore. Then 2 seats were in Bhaura Institute, Cancer Institute, which is in Guwahati. So total accounts for 15 seats. So last year what happened is it was a common for both clinical hemat and medicine, this DM oncopath. So there were lots of people who got both ranks in clinical hemat and DM oncopath also. So as a result, the top 10 who got a clinical hemat as well as in oncopath, they took a clinical hemat. So in the last year, the last rank which took the DM oncopath was 25th rank. Okay. Even though there were 15 seats, the ranking went up to 25th. But this year we don't know, because the pattern has changed, everything has changed. We can tell only after the counseling. And this year in 2022, according to NMC website, if you go and check in NMC website, the number of DM oncopath seats appears to be increased, somewhere around 21 seats. New institutes like Varanasi and Jaipur and Yennapoya from Karnataka, Mangalore are added. The seats are added from there. So you can go to NMC website and check. So my point of view is, if you are seriously preparing for DM oncopath and NEET SS, make sure you are under the 20 rank. Then only you will be getting the seats. Right? So it's a once in a year exam, 150 questions, correct answer 4 marks, wrong answer -1 mark. So this was all about NEET SS. Now we will discuss about INISS. What is INISS? It is an Institute of National Importance, which includes AIMS, JIPMER, PGI, NIMHANS and Sri Chitra, Trivandrum. So what courses as a pathologist we are eligible there is, one is hematopathology, which is offered in AIMS, DM hematopathology, and in PGI Chandigarh, we have DM histopathology. In NIMANS, we have DM neuropathology. So in hematopathology, not only Delhi, all other peripheral aims like Bhopal and all those, there accounts for 8 seats. Okay. Then next coming to histopathology, DM histopathology in PGI Chandigarh. Depending upon the session what you are writing, you will have 1 to 2 seats. Whereas in DM neuropathology in NIMANS, Bangalore, we have 1 seat. Okay. And this INISS happened twice a year. One is April session and one is November session. Whereas NEET SS happens only once in a year. Okay. Now coming to what is the pattern of INISS. INISS we have 80 questions. Okay. Whereas in NEET SS we had 150 questions. So here you have only 80 questions, and if you answer a one question correct, you will be giving a 1 mark. But if you answer a one question wrongly, you will be penalized with 33%. That means if you answer 3 wrong questions, your entire 1 mark will be gone. Whereas in NEET SS, if you answer a one question, you will get 4 marks. If you do a 4 wrong questions, your 1 mark will be lost. That means in INISS, it is more of negative marking, and it is only 80 questions, right? So you have to be very careful because there is more negative marking when it comes to INISS. And in INISS, the minimum eligibility is 50%. That is, you have to get a score of 40 marks. If you are getting less than 40 marks, you are not eligible. Okay. Whereas in NEET SS, it is 50 percentile. That means you will be judged upon the number of people, how they performed. Among them, it is the 50th percentile. Whereas in INISS, it is the percentage. So you have to get 40 marks. So this was a small introduction about what all the exams after post MD. Especially I focused on DM courses. In next video, I will be discussing about different fellowship exams which you can write throughout our India and reputed institutes. Hope you like this video. Please do share and like, and let us know in the comments what all other topics you want to listen from me. Thank you and happy Dasara in advance.